going to talk a little bit about some of the recent key policy developments, and also a little bit about some of the things kind of coming over the horizon in terms of the new Secretary of State's interests, which and their kind of relevance to mental health. And I'm also, because I think this is a really interesting point in the journey, as Cathy and Tim kind of alluded to. We're halfway through the 5-year forward view commitments. They are, whilst on the face of it they look modest, I think they're challenging commitments. They're not in the bag yet. We need to kind of redouble our efforts and make sure that those get delivered. We've also got an opportunity with the NHS long-term plan coming in, to an extent with the new Secretary of State, to kind of look forward, take stock and think about where we might want to be in 10 years' time as well. And that's a kind of ongoing process, and personally really looking forward to hearing some of your reflections on some of that in the question and answer bit of it, although it's likely that probably between Tim and me we won't really have many answers, but I think we're very keen to hear what you've got to say. Just to echo Tim's point about the focus on mental health, the Prime Minister has really made it her top priority in the health sphere, and in my job we have weekly/daily contact with Number 10. They take a very active interest in what we're doing in this area. And as Cathy, I'm going to skip over these. I mean, this is kind of why, in terms of the facts, which all of you know. I think there's been a real kind of political awakening to the issues around mental health across all parties in recent years. And as Cathy said, I've worked with Cathy on a couple of occasions over recent years because I'm relatively new in the role I'm doing, but I've been around in mental health policy sort of in between going off and having babies for about the past 5 years, and it's been really interesting and pleasing to see how mental health has gone up the political agenda across all parties. And these are just some of the commitments and documents that have been published by the coalition, and then by the current government over the years. But really it's massively ramped up in terms of the political intention and focus. I'm going to touch on some of the key kind of policy developments over recent years, as I said. So I think really important, the Thriving at Work Stevenson Farmer Review, setting out what employers can do to promote people's mental health via some core standards that all employers should implement, and then some enhanced standards which the Farmer Stevenson Review recommended that the public sector, including the NHS, took the lead in implementing. Tim had a slide up a minute ago that talked about some of the programmes going on in NHS Improvement. So their work on NHS Improvement are leading a programme of work around retention, sickness absence, and delivering the Farmer Stevenson recommendations to make the NHS a leader as an employer in terms of staff mental health. And I think really important here that this is clearly about wider society. And you will have seen in the news last week that Prince William, and this was together with Mind, launched a big portal of resources that employers from all sectors can use in terms of supporting employee mental health. So I think this is going to continue to be a big area of focus going forward. Tim has stolen my thunder on the Children and Young People's Green Paper, but that is great. I think just to kind of build on what Tim says a little bit, this feels really ambitious to us, the idea of having this whole new service in schools. if rolled out across the country, the workforce, we estimate, would be equivalent in size to the current workforce working in NHS-funded specialist children and young people's mental health services. So again, it's a big challenge. I know when we did the consultation, there was a bit of frustration about why can't you go further, faster, which I totally understand. I think for us, it does feel quite ambitious, and we're really keen to work with you and other people who will have a stake and an interest in delivering this and making it happen across the country as we start to set up trailblazer sites. We're looking at announcing the first few trailblazer sites later this year, and then having further waves in following years. And I think the key point is that lots of this will be in the delivery, and we need to learn as we go. So we will be commissioning a formative evaluation that enables us to feed back live learning into what we're doing with the trailblazer sites and getting this new service right. And we need all of you on board in terms of both getting interested, promoting it, and frankly telling us what isn't working and what your worries and concerns are. And again, I'm keen to hear in the question and discussion some of your thoughts. One of the things that I hear when I'm going around talking about the Green Paper is this a kind of bolt-on that we're parachuting in a team into schools who will kind of do their own thing and not take a wider holistic perspective. Absolutely, the idea is that you have mental health support teams, you have lead teachers in schools, and that provides a focus for all the other things and great things that are already going on, great work that, for example, educational psychologists are doing, and great work going on in communities to kind of coalesce around a whole school approach to mental health. So that's what we're trying to pull off. And one of my colleagues, when we're sitting around discussing it, said it's a really important principle that there is no I can't help. So how do we get to a position in schools where children and young people can get the right support with their mental health needs? It feels like a big challenge, and we will need your feedback and your help. How am I doing for time? Okay. So I'm going to need to speed up a little bit, but I did want to say a bit more about the Green Paper. So another thing coming over the horizon, really interesting to watch for the end of the year, independent review of the Mental Health Act. So chaired by Simon Wesley, whose photo is out in the lobby here, and examining in particular why is the use of the Act rising, why are high numbers from black and minority ethnic groups being detained, and concerns that the Act is out of step with a modern mental health system. And the interim report was published in May, and found some real concerns about the experience of people who had been detained in relation to dignity and respect. And there will be recommendations covering a number of areas. This is a bit of a summary of the areas that came up in the interim report. I won't go through them one by one, you'll have them in your pack. This is definitely one to watch, and it's going to be an independent review, and then the government will need to respond in some ways. So again, a really interesting policy development coming over the horizon. Some of the other developments I will kind of I'll sort of whiz through these. So suicide reduction's been a big priority for ministers. Jackie Doyle-Price is chairing a women's mental health task force due to report in the autumn. She is very passionate about the needs of women, offenders, vulnerable groups, and keen to really champion what she can do in these areas. And then we've got the Public Health England due to launch a national awareness campaign looking at getting people active in supporting their own and doing things to improve their own mental health. And we got Tim is leading the first ever Global Mental Health Summit, which will be on the 10th of October in London. Again, that's about building the kind of international momentum about increasing the focus on mental health. Just briefly, there is someone talked about cross-government. There is almost nowhere in Whitehall that isn't interested in talking to us about mental health. So the NHS long-term plan, you will have all seen the announcements. I won't dwell on that, but the government has been clear that better access to mental health services is one of the key priorities that the PM and others want to see in the long-term plan, and to achieve the commitment to putting mental health on a par with physical health. I know people will have contributed their thinking and ideas to that process and be interested in comments. And then the new Secretary of State for Health, he has chosen 3 quite cross-cutting initial priorities, which your first reaction might be, oh, he's not focusing on mental health, but actually I think they're all pretty fundamental to mental health. So there is an online platform that was launched a couple of weeks ago, seeking ideas about improving staff experience, so absolutely about mental health and well-being of NHS staff. He's really interested, and he knows, because he started off as a programmer. He really kind of knows the kind of nitty-gritty about technology. So he's really keen to kind of champion getting the basics right and the day-to-day frustrations that staff feel in terms of technology not working. He's really keen to champion interoperability, sharing information, empowering and looking at how that can empower people to hold their own care records. Again, that feels important for mental health. And then at the other end of the spectrum, from getting the basics right, he really wants to position the NHS as a world leader in terms of health technology. And I think there's already some exciting stuff happening around digital and mental health. I think there's a lot more that could happen. And then I think possibly the most interesting one for us of Secretary of State's priorities is around prevention. So he's really interested in keeping what can be done to keep people healthy and treat their problems quickly, empower people to manage their own needs closer to home, and getting care in the right place and in settings that suit people to meet their needs. And whilst that sounds quite kind of cross-cutting and generic in terms of what it means in practice, I think there's lots for us to get our teeth into, and lots that will be really important for mental health. And there'll be lots of engagement on these priorities over the coming months. And I would really encourage people in the room to join that. Kathy, sorry, did I run over? Okay, that's really all I wanted to say. And look forward to your questions.